In a world where time is both our ally and our adversary, where the journey of life etches its marks upon us, and we constantly seek ways to improve the appearance of the signs of aging to give us a refreshed look. So in our final chat with Dr. Mark regarding medical aesthetics, we'll be focusing more on how it can assist men with a better look. Now, Mark, I think it's an interesting one because men and women have different perceptions about the importance of remaining young through time and life. But more and more, I think men are becoming aware of it because life is throwing so much at us. So what is the perception there and how is that mindset changing?
Michael, I think men for such a long time have been shying away from any kind of aesthetic treatment. The fact that aesthetic treatments has always been marketed towards women, and men don't age in exactly the same way. So men grow older and most of us get more matured, we look better, women find us more attractive, but time does have consequences on the face. And you know, emotional beauty, how other people perceive me when they see me for the first time without knowing me is becoming a concept that in aesthetic medicine we are focusing more and more on.
Okay. And I mean, beyond just that initial impression, I mean, if you're walking out feeling better, you're going to sort of present yourself to the world in quite a different way as well.
Absolutely. You know what, I think if you're in a boardroom and you constantly look angry because you have a scowl or a frown, people are going to be afraid of you, so they might not open up. And that's starting to change.
Okay.
It's not about the metrosexual male that takes better care of himself. It's about how we portray ourselves to other people and ultimately how you feel about yourself.
Now, is the nature of the skin of a male and a female different in the way that it ages and the structural changes?
Yeah, absolutely. Men's skin have more oil glands, so you know what, it tends to be more moisturized. And you know what, if you have been shaving, you've been exfoliating your skin physically instead of chemically or with abrasives, and that gives us a better appearance. Also, you know what, men with lines around the eyes, which gives character. If you look at your old Hollywood stars, all of them had lines around the eyes, and that was very sexy. So, you know what, that perception is still there. We're starting to see fuller lips in men, kissable lips, same as with women. It gives you a sense of sensuality, but there are small things that you can do to improve a restful, youthful appearance without letting anyone know that you've really had any treatment done.
Okay. We've actually got a case study here, Mark. This is one of your patients, and it's quite interesting. Again, I want to just point out, it's the subtleties, and you said there as well, the small things that you can do. So let's talk about what's been done in this instance.
So I think this is a beautiful example of emotional beauty.
Right.
So if we take a look at the before picture, if this guy was sitting in a bar, my first impression would most probably be, he looks sad, he looks tired. You know what, I'm not going to make an effort to go and talk to him. And if we look at the other side, this is a far more approachable person, but we haven't done much. He just looks rested, he looks a little bit more youthful and definitely more vibrant. So the problem that this person had is he had eye bags. So there was volume loss in the mid-face, in this area that sits here. And that leads to a decrease in the support of the tissue under the eye.
Okay.
Now, there's structural changes that happen to the skull. As we get older, the shape of the orbit of your eye socket changes. It's usually round when we're young, and as we get older, it starts changing into oval, and late in life, it's actually square. So you create space where there's no support. The bone that sits on the cheek area also starts flattening and recessing a little bit.
Okay.
And there's a fat pad that sits on the bone. And as we get older, that fat pad starts I don't want to call disintegrating, but it starts breaking down and migrating lower. So it gives us these horrible nasolabial lines.
That's sort of hanging in the
yes,
cheeks.
Yes. And you know what? Again, no support for the overlying tissue. So it starts hanging and sagging. And then we start seeing the tear trough deformity.
Okay.
So what we've done for him is we've created a tiny little bit of support with a tissue filler on the bone in the midface, and then the tear trough deformity, which we can see as an anatomical deformity on the bone, we've just filled it in. So think about the deep valley, and we filled it in. So suddenly there's support for the overlying tissue.
Okay.
And that has changed the look in the eye. And that's all that we've done. We used in total 2 mils of hyaluronic acid filler on this patient.
Right.
But you know what? The look is completely different.
And it's quite interesting when you see, because you see the bags on the left-hand side there, and it's not that you've taken away the bags, you've just moved everything else around them so that they no longer are hanging like that.
Absolutely, we've just supported the tissue. And this is a treatment that will last him for 18 months.
Okay.
Quick, easy, if done with the correct type of filler, because we have different types of filler, and if the placement is correct.
Right. Now, Mark, you mentioned some of the structural changes. Again, I'm going to ask that question of how do they differ in men to women? Because if I recall correctly, when we spoke about the women's changing shape, there was quite a lot of temple sort of loss of volume.
Yes.
Here you're talking about this part under or on the cheeks. What other differences are there between men and women?
So inherent aging stays the same, the intrinsic aging, where we have changes to the bone. So it might be a little bit slower for men than for women, but you still have flattening of your zygoma, this area here, the cheek area, flattening of the maxilla, which is in this area here. We spoke about changes in the orbit, but the biggest change for men, I think, happens in the mandible, the jaw itself, where the height of the jaw starts shortening. The angle of the jaw, which we would like to be closer to 90 degrees, starts opening up, so it becomes wider. So we lose the definition in this area. Then you also start seeing the fat pad that starts decreasing. So that intrinsic aging stays the same. Extrinsic aging is what we do to ourselves. So that's sun exposure and smoking and alcohol and all those kind of things. So men, I think, slightly more resilient to those changes as we get older. I think there was a survey that was done that proved women prefer a slightly older man with lines and wrinkles, strong jaw, strong nose, nice lips, square chin, because it makes them feel more secure with this person. Instead of a young boy, which is sexually appealing, but doesn't really give that sense of, I'm going to be safe with this guy.
It's sort of that appearance of being in control, I guess. Mark, one last one, just in terms of men, often these heavy lines, frown lines on the forehead and in the mid-face. I mean, are those things that also are being dealt with quite easily as well? Yes,
you can use a neuromodulator, and here we're talking about your Botoxes. Remember, Botox is a trade name. In the neuromodulator South Africa, you have Dysport, Botox, and Xeomin. They treat dynamic lines, in other words, lines that form with movement. But if I keep on folding a piece of paper, it forms a resting line. So the ones that you are referring to are resting lines. Especially the angry ones that sits between the brow, makes us look as if we're scowling. So that was probably one of the treatments that I did most for men.
Great. Mark, unfortunately we've run out of time. I think we could go on a little bit about this one, but let's just remind people where they can get hold of you if they'd like to get a bit of information first.
If you want to know more about this, my aesthetic practice is called Dr. Mark Aesthetics. We're based in Bryanston, 010-824-1393.
Okay, great. What would be sort of maybe a couple of key tips for guys to think about in their daily life, their daily routines that they should be doing to just keep them going a little bit longer before their age starts to show?
Sunscreen, sunscreen, sunscreen.
Okay.
Just a good sunscreen. Lots of water, regular exercise, and good sleep.
Okay, wonderful, Mark. It's simple as that. And thank you for sort of breaking this down for us to make it a bit more understandable and also relatable to everybody, not just those who are looking to be absolutely pristine always.
Michael, small things can have a great impact if done correctly by someone who knows what they're doing.
Wonderful. Mark, thank you so much. Great to have you with us as always.